This is Nicole Jarrett. You've joined the SBA Comprehensive Community-Based Reentry Program Utilizing Mentors introductory webinar. I just wanted to make sure that we're good to go. It's time to start. Hello, everyone. Thank you for joining today's webinar. My name is Nicole Jarrett. I'm a Senior Policy Analyst at the Justice Center. And before we move along, I wanted to take care of some housekeeping items. At any time during this webinar, you can ask a question by typing it into the Q&A panel at the bottom right-hand portion of your screen. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. For the content-related questions, we will keep a running list and address them at the end of the webinar, and we'll do our best to get through as many questions as possible. Since this is a relatively small webinar, we may also be able to just open up the lines, and so we'll be able to let you know about that later on as well. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239. Please understand that there are some technical issues you may not be able to resolve. For this reason, we're recording the content portion of this webinar, and we post it on our website at csgjustice.org/NRRC. We should have the webinar posted online early next week. Once it has been posted, we will email you a link to the recording. At this time, I would like to introduce our speakers. With us, we have Dr. Gary Dennis, the Senior Policy Advisor for Corrections at the Bureau of Justice Assistance, as well as Dr. Beth Skinner, Director of the Justice Center's National Reentry Resource Center. At this time, I'm going to turn it over to Dr. Dennis for some opening remarks.
Thank you very much, Nicole. Certainly, we at the Bureau of Justice Assistance appreciate all the good work that the National Reentry Resource Center and the Council of State Governments Justice Center do. The mission of the Bureau of Justice Assistance is to provide leadership and services in administering grants and in setting criminal justice policy or helping local, state, and tribal agencies to develop that. I think in the last several years, and particularly in the corrections area, that BJA, through the work of our technical assistance providers like CSG, have really become sort of the action thought leader in the field of corrections, particularly as it relates to reentry. I was fortunate to come to work for BJA about 6.5 years ago when the Second Chance Act had just been signed into law. And in 2009, some of you will remember that we got the first appropriation for Second Chance. It was at that time $25 million, and $10 million of that went to fund mentoring projects. So the mentoring section of the Second Chance Act is the only one, of course, that's open exclusively to private nonprofits, including faith-based organizations, and really shows the degree to which the drafters of the legislation think that providing mentoring services is important. The first 5 years that we funded the mentoring projects, we asked that the project recipients, grant recipients, establish a mentoring relationship with the clients prior to their release, and then provide at least one reentry service to them. It could be assistance in developing job-related skills, it could be housing, it could be some type of treatment services. And that, we think, has worked well. But this year we decided to take a little bit different approach. We went back to our FY2013 applications and picked up 12 applicants who scored well but not high enough to be funded in 13, and these are the projects that will go for 2 years. They're $300,000 grants, and Dr. Skinner and Nicole will talk a little bit more specifically about that. Again, with the idea that they would serve about 125 clients during the year, the 2-year project period, and that they would provide some reentry services based on a needs assessment, but we weren't really expecting with that relatively small amount of money to provide comprehensive services. The difference this year is that 7 of you all, hopefully on this webinar, were given grants of $1 million for up to 3 years to provide services to a minimum of 250 clients. One of the things that we've learned through our work in the last 6 years in reentry is that it's not good enough for someone just to have a job and a place to live, that we've got to do a comprehensive assessment of what their needs are and their risk level to recidivate would be, and then we have to plan a comprehensive menu of services, including supportive housing, job readiness and assistance in keeping a job, as well as substance abuse and mental health treatment, any other services that they might need. So the 7 grantees who received the $1 million awards are expected to do just that. They're expected to provide a full menu of wraparound services to the clients that they serve. We think this is probably going to prove to be one of the best approaches, but I wanted to say that the 7 large grantees this year, this is a bit of a test on the part of BJA, and we know that the Reentry Resource Center will be working very carefully and closely with you in providing technical assistance, and we're just really excited to see how many lives we hopefully can change and help to facilitate reentry. So I probably talked longer than I should have, but I wanted to make sure that you all know how proud we are of you, that you wrote applications and proposals that were funded in an extremely competitive environment. That we always have hundreds of applications and we're never able to make as many awards. So congratulations, and now you'll get some good information from the folks at the National Reentry Resource Center to help make your projects a success. Thank you.
Great. Thank you, Dr. Dennis. We really appreciate all your guidance. And right now I'm going to turn it over to Dr. Beth Skinner to provide some background information about the Council of State Governments Justice Center and the National Reentry Resource Center.
Great. Thank you, Dr. Jarrett and Dr. Dennis, for your time in pulling this together. Good afternoon, everyone, and again, congratulations on your award. We're very excited and thrilled to have you on the call today, and very excited to kick off the great work you all will be doing here in the next year. First of all, I'd just like to talk briefly a little bit about the Justice Center. We are a national nonprofit, nonpartisan membership association of state government officials, and we represent all 3 branches of state government, as well as we provide practical advice informed by the best available evidence. As you can see here on the screen, we work in different areas such as corrections, courts, mental health, reentry, justice reinvestment, law enforcement, substance abuse, and youth. Our staff here provides practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. As you can see here, these are some different publications we have here that may be useful to some of you, but some of the work that we have done, and that's also available on our website. A little bit about the National Reentry Resource Center that actually will be providing the technical assistance to you all. It was authorized by the passage of the Second Chance Act in April of 2008, launched by the Council of State Governments in October of 2009. It's administered in partnership with the Bureau of Justice Assistance, U.S. Department of Justice. And the NRRC to date has provided technical assistance to over 600 juvenile and adult reentry grantees since its inception, as well as, and we've been in approximately about 49 states. So with that background of the Justice Center and the National Reentry Resource Center, I will pass it back to Dr. Jarrett. Again, thank you everyone for your time today, and congratulations on your award.
Thank you, Dr. Skinner, and let me add my congratulations to each of you. As you can see, we represent different regions of the country, and you know, many of you are not new to us. A few of you, Center for Self-Sufficiency, KISRA, Family Pathfinders of Tarrant County have already had SCA mentoring grant awards. The Safer Foundation has been involved with us previously in helping to provide technical assistance to the field. Some of the prior grantees have participated in identifying speakers to participate on Hill events or during an SCA conference, and to those of you that are new to the technical assistance process, we are so excited to work with you. As Dr. Dennis had mentioned, there are also additional, a number of 11 specifically mentoring awards that were granted under the previous solicitation, and you can see, again, you know, pretty spread out throughout the country, and they're not necessarily participating in this call because this webinar is focused specifically on the new comprehensive community-based award. So now let's dig in a little bit more about some of the expectations around this grant program. I'm having a little problem advancing the slides. Okay, here we go. So your grant program orientation is taking place in 3 parts. Some of you were on the SBA grant orientation webinar that took place on Monday. There was a lot of great information around not only technical assistance, but also grant management. And if you weren't able to participate, the link to that webinar will be available on our website next week. The second part of the orientation process is happening right now, and that is the grant track specific orientation. And for those who've had a mentoring award before, you know this process is new, but we really are happy to have this opportunity to talk about unique program expectations and resources for community-based reentry programs. And then the next phase will happen directly with your TA provider, who has probably already reached out to you. I know all of you have been contacted. Some of you have been contacted twice. Please excuse our enthusiasm. But you will set up an initial orientation call, and during that time, we'll be discussing what the TA process will look like specific to your program. There are 3 primary entities that you'll be in contact with throughout your project. Of course, BJA, your funder, Tracy Willis, your BJA Senior Policy Advisor, will be your primary contact if you have any questions around managing your grant, grant adjustment notices. Please reach out directly to her. Of course, the National Reentry Resource Center will be providing the training and technical assistance that will occur mostly through monthly TA calls and also site visits, and we'll go a little bit more into depth with that. And then there's CSR, who develops and manages the information collected through the performance measurement tool. The SBA Mentoring Grant Program supports more effective and successful reentry for formerly incarcerated individuals through the utilization of comprehensive, evidence-based wraparound reentry plans, which address the identified needs of the individuals and are supported by trained mentors. And as Dr. Dennis had mentioned earlier, there's a high-level expectation around what that comprehensive planning should look like. So although we refer to awardees under this grant track as mentoring grantees, clearly mentoring services is just one component of an overall reentry strategy that you'll be employing. As compared to previous years, this program is fairly unique. Some of these things were highlighted earlier, and I just touch on them quickly. You know, these awards are larger than prior awards. The number of people you intend to serve is laid out in your funded grant application, but overall the minimum requirement is 250 individuals over the 3-year period. You are expected to provide a wide range of reentry services and to work collaboratively with corrections agencies to enable you to do evidence-based practices, primarily to do the in-reach services that is so critical, but yet historically has been a significant challenge for other mentoring grantees. So we're hoping with these new expectations that this will be able to move along a lot more smoothly. The target population, you're serving adults in state, local, or prisons or jails. We don't have any tribal grantees. And the individuals that you're serving must be moderate to high risk of reoffending, and using empirically validated risk assessment instruments would help define exactly what risk level the individual you're serving. You're required to provide both pre- and post-release services that include mentoring offenders in a pre-release setting during incarceration and through the transition back into the community and post-release, and then provide a comprehensive menu of transitional services that include incorporating cognitive behavioral approaches. Your mentors must receive training in the following areas: the characteristics of the criminal justice system, corrections, and the reentry process, all relevant policies and procedures of the correctional agencies and facilities on accessing the facility, rules around conduct, etc. How to enhance interpersonal communication skills, including active listening and motivational interviewing. Describe what criminogenic needs are and their relationship to recidivism, and let them know how criminogenic needs will be addressed in your reentry strategy in your particular program. During your training, increase awareness around victim-related issues, and although you're working primarily with volunteers, they should feel empowered to know about, help them feel more empowered by helping them know about the transitional services that are available in the community and how they should handle referrals to other agencies and organizations. Be clear about boundaries, ethical standards, and the nature of the mentor-mentee relationship, and discuss how they can be safe and other safety issues. You must track participant outcomes for at least 12 months following release and obtain information about recidivism from the relevant corrections and/or supervision agencies, and this is part of your reporting requirements. We're excited about being able to support you as you do this work. Specifically, your designated NRRC technical assistance lead will provide and coordinate support in several different areas, including the completion of a mentoring, planning, and implementation guide, and we'll discuss that more in detail in a moment. Identifying measures and strategies to track progress, content areas and facilitation of support, and sharing successes with stakeholders, the field, and the press at large. We understand that you have a lot to accomplish, and we offer a wide variety of technical assistance, and we use a number of different strategies, including helping to provide guidance on engaging a leadership team, meeting participation and/or facilitation, helping to share information, sample policies and manuals, MOUs, objective feedback and recommendations on trainings and resources, any guidance on policy and procedure development. We help monitor any progress and note any accomplishments and promote efforts and achievements within and beyond your jurisdiction. We hope to be a source of constant support for you, especially during the first several months of your initiative. We know it's a very busy time for everyone, and we're available via phone, email, and in person. Additional technical assistance comes in the form of training, referrals to expert consultants and resources. And our goal is that we do not offer really necessarily a cookie-cutter approach to TA. It really is us trying to be responsive to your unique needs and strengths, helping you to meet your identified goals and objectives. And I think it's important for us to know that this is not an audit of your program. We're not trying to find any particular faults. Again, we have a very strength-based approach to the TA that we provide, and again, I couldn't say more how excited we are to work with you. It's not just me. There's two other people on the technical assistance team, including TD Umas, who's on the line, as well as Dan Bader. So one of the new resources that we've developed is a tool that we're calling the Mentoring, Planning, and Implementation Guide. It's something that's not necessarily new to us as a Justice Center. We use planning and implementation guides with our other SBA grant track programs, and in some instances, those are actually something that's required for them to fill out. In this instance, it's not a requirement, but yet we found that it's such a helpful tool to, especially in the planning phase, to work with the grantees, to work with each one of you to identify areas for improvement and mapping out where you'd like to go over the course of your project. And so we find that it helps build capacity, identify strengths and areas of improvement, and target areas for TA. Right now, most of you are still in your planning phase. I know some of you have been at this for a while, so you may also be in the implementation phase while you're also looking at how to expand, adopt, or change. But during the planning phase, we will work with you to help complete the Mentoring, Planning, and Implementation Guide in phases during our initial TA calls. And during that first TA call, that's when your TA provider will send you the Planning and Implementation Guide and walk through what sections to complete and when. And again, this is a tool primarily for you, and it's helpful for us to map out what TA could look like in the coming months. The planning phase can be very busy, and we've condensed it to 6 areas: reviewing of program vision and goals, establishing a work group and engaging partners and stakeholders, creating a plan to reach the target population, identifying individual client needs, developing pre- and post-release services and programming, utilizing evidence-based practices, structuring your mentoring services, and establishing a data collection, program evaluation, and sustainability plans. So if some of you feel tired, you have a good reason to feel tired, but we're really excited to come along with you. And I want to talk a little bit about each one of those areas. Often when we first get on the phone with you, we want to find out whether or not things have changed in terms of your goals and objectives, and we understand that relationships change, things sometimes shift from the time that you submit a proposal to the time that you're actually able to move forward. And so this is a great time, if you haven't done so already, to review the vision and mission, not only because the landscape may change, but you also are bringing on new partners. And so doing that environmental scan and looking at what you propose and how you can even strengthen what you propose, this is the time to do that, and we're happy to work with you on that. Establishing a work group and engaging partners and stakeholders, of course, very crucial. Looking at who's making up your team. Many of you are in the process of perhaps hiring additional people on the team, perhaps mentoring coordinator or a case manager. And then within your organization, mentoring this particular program will likely be just one component of a larger program. But looking at what other supports internally could help you accomplish the goal of this particular grant program. You'll be looking at your key partners, the service providers that you'll be working with and referring out to, and other key stakeholders who need to know about your initiative, who do you need to keep abreast, and how often will you need to meet with them. And are there other people that really need to be at the table? And with all those relationships, what are the policies and procedures in place to help smooth out communication and collaboration? Is everyone clear about what their role is and how that fits into the plan for success? This is also the time in which you are creating a plan to reach your target population, so working specifically with corrections, making sure that everyone is clear about your eligibility criteria, understanding the process of when and how people are going to be screened and assessed, what tools you'll be using, where you're going to be getting certain information. So if your corrections partner is the one doing the risk assessment, you know, how are you going to get that information, and really nailing down all the policies and procedures around that. Again, we talk often about criminogenic risk and needs, but we know that there is a whole host of support services and transitional services that your client will need, and how are you going to identify those needs. And one of the pieces that we want to make sure that you are collecting is also understanding each individual's supervision status, and thinking also about additional partners. Is community supervision, probation and parole, a partner that you need to engage? And so, again, I think that's a really important part of the planning process. Looking at the services that you're providing, mapping out the delivery of those services. Exactly when are you providing the pre-release services in the corrections facility? What does the transition process look like? Who is your case planners and case management? What are the tools available to that person? How will the participant connect to community-based providers? How will you keep clients engaged? And what cognitive behavioral approaches will you be incorporating, and which evidence-based practices will you be utilizing? Structuring mentoring services. At this time, you should, if you haven't already done so, you'll be choosing your mentoring model. You know, what best suits your particular program. You'll be creating a recruitment plan. Which organizations will you be reaching out to? Will you be using peers or natural supports or alumni? You'll be defining what the roles the mentors will be playing, what their expectations are, how they should be interacting with their larger program, laying out what the initial training plan will be, how often that training plan will take place, and what will the in-service training will look like. So you have the big initial training. What will ongoing training and support will look like? What is the strategy you'll be using to match mentors with clients? And also during this time, you'll be establishing policies and procedures that really map out accountability. What is the, what type of reporting will you ask your mentors to fill out and complete, outlining the types of communication, what they should be communicating to program staff, what program staff will be communicating with the mentors, what should they be doing in a crisis situation, what information do they need to collect to help with data collection efforts, and also outlining ongoing support. And as well as you think about engagement strategies for mentees, you'll also be thinking about engagement strategies for your mentors. We're cheating a little bit on this one because we added a few things. Data collection plan, the program evaluation plan, and sustainability plan. So identifying what your program evaluation goals are. And again, this minimally, you will be collecting information that meets your grant requirements, but you may have broader evaluation goals, which we strongly encourage, and we are very excited to be of any assistance in that area. creating a data collection plan, being very clear about the information that you're collecting and who is collecting it, how often, and when. Of course, recidivism rates is a big part of that, and so happy to talk to you about definitions around recidivism, talking about baseline recidivism rates and tracking, you know, how are you getting this data? And then also assessing sustainability strategies and planning. Some of you are already engaged and thinking, always thinking 2 steps ahead. Some of you have already done a great job in just announcing that you're part of this initiative, which we think is important, really highlighting the opportunities available in your jurisdiction. So ideally, the planning phase will inform the implementation phase. And the implementation phase is where we identify areas in which you will work on, specific action items, the time frames, ongoing monitoring and revisions, and plans that, of course, that can be updated with progress as you move along in your program. And again, we all know that you are very sophisticated in the work that you do. You've been at this for a while. Again, but one of the things that we find that this particular process, it seems to be really helpful to come together on a monthly basis to just talk big picture what's going on with the team and talk specifically about what needs to be improved upon. And so some questions that often come up during the implementation phase that will impact what came out initially out of the planning phases, you know, are we on track for reaching your program goals? Are we reaching the numbers of participants that we initially thought we would be able to reach? What types of adjustments will we need to make? Do we need to broaden the number of facilities that we go into? How will we work around a partner who is no longer engaged? How can we increase client engagement and recognizing any patterns really early on? Are you seeing that younger participants are not as engaged as others? Are you finding that it's immediately after release you're losing people in that transition phase? And how do you create the necessary supports around that? How can we meet unmet needs? Are clients and participants coming to you with needs that you weren't necessarily attuned for or prepared to handle? How do you adjust and to meet those needs, whether directly or through a partner? How can you improve mentor and mentee relationships? Are you providing the necessary tools to help the mentors, and help the mentees make that time as productive as possible? And how do you know if your training is effective? And some other questions, why are so many of our clients returning on probation and violations? So, you know, recidivism, you know, looking at recidivism, you know, that should be an ongoing process. You don't want to wait till, you know, 12 months have gone by. You should be looking at that. Clearly, that's part of what you'll be reporting on, but that should just be one of those things that's just constantly informing your program plan. So these are just a sample of some questions. We know that there's a lot of other things that go into how your program will evolve over time. And so with that, we will open it up to questions. And I don't know, Jen, is this open? Are the lines open, or do we have to have people type in?
The lines are open, so if they want to speak, they can speak, but they can also just type in their question at the Q&A box if they'd like to.
Okay. Are there any questions about the process? Okay. Well, hearing none, I think we could wrap this up a little earlier than than we initially expected, which is fine. I know when we get on the phone with oh, I'm sorry. There is a question, can we get the guide sooner than later? The guide is being finalized right now, and so we'll get that out to you as soon as possible. Any other questions? Well, what are organizations doing to recruit mentors with backgrounds, any evidence-based practices? Okay. And so, this question around recruiting peers and recruiting volunteers that have criminal justice backgrounds. I know for many of you, you'd like to see more participation in that area, and one of the major considerations is when you're looking at providing pre-release services. And so the correction agency may have some very specific guidelines around who is eligible to come in to provide those services. And so, one of the strategies that's often used is that if you have an individual who is a peer that has a criminal justice background, they may not be able to participate in the pre-release services, and they may participate in the post-release services. And I think it's really important as a team to talk about specifically what is the criteria for peers, and of course being really clear that they have to participate in the training, but also are you looking at individuals who are at least minimally 3 to 5 years post-release? So those are questions that you need to discuss as a group. But there is a lot of support for the importance of peers in reentry. Okay, another question. What are organizations doing to recruit mentors with, what are organizations doing to recruit mentors with backgrounds? And so I think one of the areas, and we could, I don't know if we can open it up to discussion or not, because it would be great to hear from all of you, but some of you have been really successful recruiting people with backgrounds, criminal justice backgrounds, from doing outreach at employment services groups, looking primarily at your alumni group. I mean, many of you have been at this for quite a while, and, one of the constant messages that we hear is that there is a narrative of wanting to give back. And so I would say making that something that's known, that you are willing to take alumni to serve as mentors. The other piece, we have some mentoring programs that have been successful in recruiting peers from substance use recovery services. So they've been recovery coaches in the past, and they find it a fairly easy transition to move into mentoring. There's a little, there are some differences, and that's some of the things that you would have to work out as a team and through training. But those are just a couple of different places. But, one of the things that we don't talk about is that, in the communities that you're working in, you have people with criminal justice backgrounds, and so the normal places where you often do recruitment, faith-based organizations and service organizations, you'll also find that you have individuals with criminal justice backgrounds there as well. And if you make it known that you're open to working with them, you'll find that people will make themselves available. How long is the typical planning phase? The planning phase typically goes anywhere from 6 months to 1 year, but that really is up to you. There is no set planning phase for this grant track. Okay. Well, seeing no other questions, this concludes our webinar. After you exit the webinar, a brief survey will appear on the screen. By answering the questions in the survey, you'll be helping the Resource Center improve on the services we offer. We'd greatly appreciate it if you take a few minutes to complete the survey. And we'll email you a link to the recording of this presentation as well as a link to the PDF of the PowerPoint slides used in the presentation in the coming weeks. And as I mentioned earlier, the link will also be available through the National Reentry Resource Center's website, csgjusticecenter.org/NRRC. I encourage you to sign up for our newsletter as well. Thank you again for your participation, and we look forward to meeting and working with everyone. Take care.